Hi, I'm Bill Behan. I'm the Director of Nursing here at CHR.
Hi, I'm Courtney Sheehan, licensed professional counselor, one of the senior program directors here at CHR. Bill, can you tell us a little bit, what is blood pressure and high blood pressure?
Sure. So normally blood pressure means the amount of pressure that our heart is pushing on our blood against our blood vessels and our tissues in our body. When we talk about high blood pressure or hypertension, we're talking about when our blood pressure goes high and stays that way over periods of time.
So, is a high blood pressure, how serious is that? Is that a health crisis?
It sure can be. When it depends on how high the reading is and what kind of treatment and care the person is getting for it, but it sure can be.
So, as a behavioral health professional, I'm used to maybe calling an ambulance for someone who's actively suicidal or experiencing an increased acute psychiatric symptoms. Is a high blood pressure, could that fall into that same category?
Oh, you bet it could. If the blood pressure is high enough, and we do have a high blood pressure standard here at CHR that follows the American Heart Association standards. If the blood pressure is high enough, it absolutely is a crisis and absolutely warrants a 911 call. Absolutely, an ambulance should be called and the person must be seen in the hospital to prevent something like a stroke or a heart attack.
Is it safe to say that checking someone's blood pressure could potentially be a life-saving intervention?
Oh, you bet. And it may not be as dramatic as the example we just gave, but if you're the person that identifies the high blood pressure in one of the people that we serve here at CHR and helps them get into care and treatment for their high blood pressure, you may contribute to a longer life. You may contribute to a healthier life. Tell me a little bit about how high blood pressure can affect someone's mental health.
Yeah, it's really important to talk about that because what we know is that individuals that are experiencing high blood pressure have higher rates of anxiety and depression. And long-term untreated hypertension or high blood pressure can have an impact on somebody's cognition, their thinking and their memory.
I'm sure, pretty significant.
So I'm hearing folks talk a lot more about checking vitals and taking blood pressures and behavioral health staff doing that. What are we doing at CHR with that, and what does the future look like?
Sure. So the future is integrated care, and not just at CHR, but everywhere. We know that if we integrate our healthcare, we serve the people in our care better, right? So we've provided a tremendous amount of training to many of the programs here at CHR to teach folks about blood pressure and high blood pressure and how to identify what can be done about it, how to check someone's blood pressure. We've built into the training components to make our method of checking someone's blood pressure and identifying high blood pressure a tag-friendly experience, in keeping with our tag-friendly values here at CHR. We've also provided a lot of new electronic blood pressure cuffs that are self-taking. So it takes less experience and less equipment to be able to properly assess someone's blood pressure.
So, checking somebody's blood pressure is part of integrated care, and part of integrated care is care coordination. So what are some of the care coordination steps staff can take if somebody is struggling with high blood pressure?
So the number one thing that a staff can do, and that's an excellent question, right, is helping the client you're serving get a primary care doctor or a primary care provider that they can work with, and helping them maintain, keeping appointments, following up with care, lab work, prescriptions, those kinds of supports. Because we know if we identify high blood pressure early, it helps us treat it better. It helps people live longer and healthier. It helps prevent some of the diseases that we experience when blood pressure goes untreated. Certainly, the things like stroke and heart attack are there, but certainly other things, diabetes, kidney disease, other things. So I think it's really important to help somebody engage with a primary care provider and stay engaged, and helping some of the folks that we work with learn the skills to stay engaged and be a healthcare consumer. Also at CHR, we offer a number of wellness groups and other wellness services that may be helpful.
Thanks, Bill. That's really helpful. To learn more, please see the links about high blood pressure and integrated care.